Welcome to the deep dive. You know, we often don't think much about our liver, that sort of silent workhorse inside us, until maybe something feels a bit off.
It does so much behind the scenes.
Exactly. But what if we could get a better handle on what's going on with this really crucial organ?
That's what we're talking about today.
Yeah, today we're doing a deep dive into liver blood tests. What are they? Why do they matter? And, how can they help you stay healthy, maybe even right where you live, like, say, in Salisbury?
It's quite amazing, actually, how a fairly simple test gives us so much useful information about our health. And for this, we're looking at some really helpful insights from a guide over on Blood Test UK.
That's the one. So our goal here is pretty simple. Quickly unpack the big benefits of these tests, give you the important facts without, making it too complicated.
That's good.
So let's start basic. What exactly is a liver blood test checking for?
Okay, so think of your liver as like the super important processing center. It cleans things up, makes fuel for your body, stores energy, loads of jobs.
Right, busy organ.
Very busy. So a liver blood test looks at certain proteins and enzymes, special kinds of proteins in your blood.
Yeah.
The levels of these things tell us how well your liver's doing its job and if it seems healthy.
Okay, so checking the staph levels, almost. See if everyone's working properly.
Yeah, kind of like that. It checks if the liver's machinery is running smoothly, let's say. And it matters because a healthy liver helps you feel energized, helps fight off infections, and use the food you eat properly.
Got it. And knowing that role really makes it clear why testing is important. So what are the main reasons someone should think about getting one, the big benefits for you?
Well, the biggest one definitely is catching problems early, seriously early. Your liver can have issues brewing things like fatty liver, where too much fat builds up, or hepatitis, which is basically liver inflammation, often without you feeling a thing.
No symptoms at all?
Often, yeah. At least not at first. So these tests, they're like an early warning system. They can spot these things before they become really big problems.
Yeah.
And, the sooner you find out, usually the easier it is to sort out.
Wow, okay. That's powerful. Spotting something before you even feel unwell. But it's not just about finding new problems, right? What if you already know you have a liver concern?
Exactly. It's also crucial for keeping track. If you are managing a liver condition, or maybe trying a treatment, these tests help your doctor see if it's actually working. It's kind of like getting a progress report for your liver.
A report card.
Yeah, a report card. And here's something else, kind of deeper insight. These tests can sometimes hint at wider health stuff too.
Oh, like what?
Well, sometimes certain liver enzyme levels, even if they're still in the normal range technically, might subtly point towards things like early insulin resistance, or maybe even a higher risk for heart issues down the line. It's not just about the liver in isolation.
Huh. So it connects to your whole body's health, potentially.
It really can. It gives clues about your overall metabolic picture, which is pretty neat from one test.
Okay, that's a really interesting angle. So for people listening, maybe someone in Salisbury, for instance, thinking about this, how does it actually work? Getting the test done.
It's usually very straightforward. Just a quick blood draw, normally from a vein in your arm. Doesn't take long, usually not too painful.
Standard blood test procedure then?
Pretty much. Your doctor might ask you not to eat or drink anything for a few hours before, but they'll tell you exactly what you need to do.
And getting it done locally, say in Salisbury, is that easy?
Oh yeah, absolutely. It's a common test. Places like Salisbury District Hospital, or local clinics like City Health Clinic, St. Thomas Medical Center, South Wilts Medical Center. Your GP can usually arrange it easily through places like those.
Right.
Access is generally good.
Good to know it's accessible. So you get the test done, then you get the results back. What happens then? How do you make sense of the numbers?
Right, so your doctor's the key person here. They'll sit down with you and explain what your specific results mean. Sometimes, if certain numbers are high, like enzymes called ALT or AST, it might suggest the liver's working extra hard. Or maybe it's a bit inflamed or damaged.
Because those enzymes leak out.
Exactly. They're usually inside the liver cells, so if they're spilling into the blood, it signals something's up. But, and this is important, one test result is just, one piece of information.
Right, it's not the whole story.
Not at all. Your doctor looks at everything, your results, how you're feeling, your history, other tests maybe. It's about the bigger picture.
So what if the results are outside the normal range? What kind of things might happen next?
Well, the first step is always talking it through with your doctor. Don't panic. Depending on what they find, they might suggest some pretty simple steps first. Things like making healthier food choices, getting a bit more active, maybe cutting back on alcohol if that's relevant. Simple lifestyle changes can often really help your liver heal and recover.
Okay, so practical, actionable advice usually follows.
Yes, absolutely. It's about working with your doctor to support your liver.
That makes a lot of sense. It really sounds like liver blood tests are a simple but really smart way to check in on such a vital organ.
Definitely. They give you those big benefits, catching things early, monitoring your health, even getting clues about your overall well-being.
Helping you make choices for better health all around. So, wrapping this up, knowing how crucial your liver is and actually how relatively easy it is to get these insights, what's maybe one simple step you could think about taking today just to be a bit kinder to your liver?